now 7 minutes late. Again, my apologies. I will go ahead and get started. So Lyme disease and its co-infections impact at least 500,000 people per year. That is 476,000 by CDC standards, but that number, and they have accepted this as well, is much below the reality of Lyme disease, especially because of things that we've seen in terms of testing difficulties and ways that states share information to the federal government. So some of these patients may experience neuropsychiatric issues such as brain inflammation, poor sleep, and even psychosis. Other psychiatric issues include depression, anxiety, panic attacks, depersonalization, bipolar disorder, OCD, dementia, and more. I'm very thankful to all of our panelists today and for joining us and allowing for Project Lyme to present this webinar as a resource to patients in our community, and as well as caregivers who are trying to support them through their journey to recovery. Our panelists today will address frequently asked questions, look to dispel any confusion about neuropsychiatric issues, and overall just ideally provide some strategies for individuals to cope, again, as they go through their journey to recovery. So I will go ahead and jump into our guests now and actually introduce them. First, I will start with Dr. Jane Mark. Jane, will you please raise your hand so everybody knows who you are? Possessing a bachelor's from Brandeis University and an MD from Boston University School of Medicine, Dr. Mark joins us today with 40 years of experience treating people with emotional pain from many different sources. She is trained in internal medicine before becoming a psychiatrist and did fellowship training in psychiatry treatment of medically ill individuals at Long Island Jewish Hospital. Throughout her career, she has used a variety of methods such as conventional psychotherapy, psychopharmacology, as well as complementary medicine, and innovative techniques such as EDMR. Dr. Mark takes her patients, just as I described earlier, on a journey to recovery. As a founder and board member of Mothers Against Lyme, one of our partner organizations, she has a depth of experience with this disease. Additionally, we have Dr. Rosalie Greenberg. Thank you for joining us today, Rosalie. She received her MD from Columbia University's College of Physicians and Surgeons, where she subsequently trained as an adult psychiatrist, and then did her child psychiatry fellowship, which, as I learned from discussing with Rosalie and getting her involved, is an additional 2 years of training to get that child psychiatry certification. She then served as a chief resident and subsequently continued her years as a teaching faculty at Columbia University. She is a firm believer in the power of education, and Dr. Greenberg is an author, researcher, lecturer, co-producer of an educational film, creator and host of an award-winning cable show, all related to children's health and having geared towards medical professionals, as well as majority of the individuals on this call today, which would be considered the public, individuals who may not understand these issues as in depth as Rosalie, Jane, or Audrey. She also brings 40 years of expertise to topics that range from adolescent suicide and pediatric bipolar disorder, plus the many psychological aspects attributed to Lyme disease. Working in New Jersey, where Lyme disease is endemic, she started to add testing for Lyme and co-infections that were carried by ticks to her patients' routines. She found a sizable number of children ended up testing positive for Lyme disease, most of whom had never had a known tick bite, let alone a classic bullseye rash, often associated with Lyme disease, which, as we know, is a common misconception by the public. Lastly, I'll introduce Audrey Amir, our host for the evening now. She is a licensed social worker, therapist, and coach who offers a variety of treatment models, including creative writing, narrative approaches, art therapy, mindfulness, wilderness and nature-oriented approaches, trauma-informed yoga, as well as EDMR with focus on parts work and cognitive behavioral approaches. Specifically for Lyme disease and other chronic illness patients, she provides caregiver support and education, and she looks to find individual balance and self-care and help provide that connection and community to the individuals that she works with. So thank you again for all three of you for joining us this evening. And I will now go ahead and jump into the discussion, which is why everybody is here. So first, I'm curious to learn a little bit about all of your backgrounds involving treatment of Lyme disease within patients. And first, I will start with Dr. Mark. Dr. Mark, why did you get into this field and when did you begin treating Lyme patients?
I began treating Lyme patients in around 2011 or 2012, and I got into the field in a circuitous way of finding myself moving through life, getting sort of thrown in one direction or another that ended up pointing here. So I was diagnosed as having Lyme in 2010 when I was age 60, and I had symptoms that were pretty severe and progressive since I was 17. From 17 on, I had severe insomnia, music playing in my head. I had various neuropathies. I had an inflamed knee with an effusion, chronic sinus infections. I was diagnosed with combined variable immunodeficiency syndrome, with lupus, with daily headache syndrome. I had back pain, foot pain. I was diagnosed with idiopathic, sensory, and autonomic neuropathy. And I was told even at the Mayo Clinic that it seemed totally like I had Lyme disease, but my tests were negative. So I had at least 7 negative tests, and doctors who kept thinking, you are the classic Lyme patient, but your test is negative. During that time, I managed to go to medical school. I did my internal medicine residency. I did psychiatry, which I didn't really like so much. So I did fellowship training in the psychiatric treatment of the medically ill. And somewhere around 2000, I was ill enough to be considered 100% disabled and went on disability for a few years, and still without a Lyme diagnosis. I found myself in the alternative world in 2010 and was finally diagnosed with Lyme and co-infections. I was very lucky to be treated successfully with antibiotics for well over a year. And I felt more well than I had since I was about 16. Unfortunately, I had a very traditional medical view of what an infectious organism did, how it behaved, and I thought I was cured. So I was pretty shocked when I relapsed 2 years later. And at that point in my career, I'd already gotten boards in holistic and integrative medicine. I realized that I didn't really know everything there was to know about how to approach illness. And it was a small step at that point to join iLabs and to do a year-long preceptorship with Dr. Raxlin, who I studied with weekly. I began identifying my own patients with Lyme, that I had people that I was just treating for depression or anxiety, patients who were missing sessions for summer flu. And from there on, I began diagnosing and treating more patients with neuropsychiatric Lyme. And my practice moved from primarily psychotherapy to primarily Lyme. Since 2012, I've treated about 100 patients with Lyme and psychiatric symptoms. I did a count yesterday to see. My practice has moved from 100% psychotherapy to 80% Lyme, which can also be psychotherapy, and 20% just pure psychotherapy. It's been a journey.
Yeah, it very much sounds like it, Jane. Thank you so much for providing that background. And I think that's a really interesting segue into hearing a little bit about Rosalie and how she ended up treating Lyme patients, because it sounds like you have some overlap in the story there. So Rosalie, I would pose to you, how frequently are you seeing Lyme patients with psychiatric issues, or maybe the other way around is how often do you see psychiatric issues in Lyme patients, and what percentage of your patients are those you are treating for Lyme disease?
Okay, well, 100% of my practice is pediatric psychiatry. And because I've been a specialist in bipolar disorder, I was looking for other explanations and wound up, to answer your question, over time, I have discovered that over 70% of my practice has tick-borne illness. and probably closer to 90% has some form of infection related to their psychiatric issues. So it's quite a lot, and it's unexpected in my mind. Another Lyme endemic area.
Rosalie, I think,
practice.
yeah, Rosalie, I think you cut out very quickly. Please restate what you had just stated. I believe you were talking about where it's located and how it essentially, yeah,
Sure.
Yeah.
Well, look, I was trained in biological psychiatry at Columbia, and I've always been very biologically oriented. I trained with people who put childhood depression on the map. I was very active in studying pediatric bipolar disorder. And as we got into learning more that infections can cause some low-grade encephalopathies or different types of problems that present with psychiatric difficulties, I decided, well, let me test my patients. And I started doing the typical testing for strep, mycoplasma. And then one day, so that got me into PANS and PANDAS, pediatric acute onset neuropsychiatric syndrome. PANDAS is secondary to strep. PANS is psychiatric symptoms secondary to some form of insult, but you're not saying the specific organism or trauma that caused it. Okay, so I'm looking at these biologic reasons for why my patients are having their psychiatric issues, because some kids are treatment resistant. You try very hard and you can't get them better. And especially the bipolar kids are very difficult. Well, supposedly a lot of the kids are supposed to have strep infections, but instead I found many had mycoplasma infections. Mycoplasma pneumoniae is the bacteria. And then I learned ticks carry mycoplasma pneumoniae. I said, okay, well, I guess I'll learn about ticks. And that was around, I guess, 8 years ago, and it changed my life completely. Especially, I think, because I am known as a pediatric bipolar specialist. And many of these kids present looking like pediatric bipolar. Okay, I think neuroborreliosis, neurological Lyme, occurs in anywhere from 10 to perhaps 40% of individuals who wind up having more chronic Lyme. And in the kids, I think often the neuropsychiatric issues are the presenting symptoms, and very typically bipolar type of symptoms. I just remember when I was first asked to talk at ILADS, I looked at my data reviewing my patients, and I said, I can't get up there and tell them that everybody, 19 out of 20, have tick-borne illness. That's ridiculous. They're going to laugh at me. But it was true. And over time, I found that approximately 3/4 of the kids with bipolar disorder in my practice have tick-borne illness.
Thank you so much for sharing, Rosalie. I think that the parallels between your practice and Dr. Mark's practice are very interesting, and especially the fact that neither of you went in with the specific purpose of treating Lyme as a neuropsychiatric illness. It just presented itself to you that way with the type of individuals that you're treating and the endemic areas that you're located in. So thank you very much, Dr. Greenberg. That was very insightful. I will now move over to our social worker on the team. We have Audrey Amir. I'm very curious, Audrey, a little bit first, I think it's important to share where you're located versus Dr. Greenberg and Dr. Mark, but also what brought you into the field and why or how you may have began treating Lyme patients.
Yeah, so I'm currently in North Carolina. I was in New York for many years. I've been here now about 4 years, which has changed a little bit the way I'm practicing. It's not as endemic, although there's still a lot of Lyme here. It's just not as well known. There's not as many resources. So I would say my practice now is probably 65% Lyme patients. Although I would say at least twice a month, I have someone calling or coming in who I have to refer to a Lyme literate doctor because they present very strongly for a potential tick-borne infection. So it's common and it's here. The way I got into it was actually sort of the flip. I was a child with Lyme disease, got sick, 12 years old maybe, presented much as Dr. Greenberg is describing, went through that whole process, wasn't actually diagnosed until much later in life, my 20s actually. And so experienced all of that firsthand and had to sort of climb out of that, I'm going to call it that pit, and then went to social work school, not necessarily with the goal of treating Lyme or working with people with Lyme, but certainly with an interest in working with chronic illness. And little by little, referrals came to me, a friend of a friend or a physician that I had worked with. And over time, it ended up sort of blooming into a pretty Lyme dominant practice. I'm also trained in various psychotherapy techniques for trauma. So those tend to go hand in hand, because I'm sure everyone watching this knows that Lyme comes with all kinds of really unique challenges that leave their mark. So some trauma work, some Lyme specific work. I do a lot of work with caregivers, families, community outreach. Yeah.
Thank you for sharing that background, Audrey. I know that I'm very excited to ask you some questions later on in the evening about coping strategies. I really think you have some unique insights to be able to share with our patient population. But what I'm going to go ahead and do now is move on to Dr. Mark again, and mainly focusing on the background of the type of patient studies that she has done and patients she's worked with, and sharing maybe how she has worked towards the patient rehabilitation. So at this point, Audrey, I believe that Dr. Mark has some screen sharing, so just be prepared for that. Dr. Mark, is that correct?
I do.
All right. Well, I will go ahead and turn it over to you and allow you to share some of this information about the type of patients that you work with, examples of how you work towards rehabilitation, and take it away.
Okay, well, let me just start out by saying that most of my patients started about age 17, and they have severe anxiety and mood disorders with insomnia and panic attacks. A smaller but still significant number have OCD, and in addition, another smaller number have symptoms of autism spectrum disorder or psychosis. Although the psychosis is generally different from what I used to see with schizophrenia, as there's a lot of preservation of reality and a recognition that this is paranoid, this is kind of crazy what I'm experiencing, and they're not really thought disordered. Most of my patients are self-referred, but a good number come from LLMDs who are hoping that I can get them through their Herxheimer reactions, which is a die-off during treatment, which makes whatever symptoms one has get worse. And I thought I would share some of my approach here. And so I just have a few slides, and I wanted to talk about what kind of problems we see with these patients. And one of them is we see problems of self as well as biological problems. And so some of the problems of self that, are people seeing my screen, my slide? No. So something did not work with that. Let me just fix that. Are you seeing it now?
Yes.
Yes.
Okay.
Good, Jane.
So these are the things that I see happening to people and their self. They're seen by others as lacking compassion and empathy, but that is because they are tremendously self-involved with the suffering that they have. And they are not sociopathic or self-centered in the traditional sense, but they may seem to be. They may seem to not care about others because what's going on takes up so much of their world. They have a sense of loss of purpose and meaning, a loss of identity, understanding if they're chronically ill or will never be the person they were again. This is who we are. They also have relationship issues that come from having Lyme disease. And these have to do with being a burden, allowing themselves to be dependent or feeling that they're too dependent, feeling that they have nothing to talk about besides their Lyme. They have guilt, they have shame, and And issues that they had before Lyme are still there. So whatever traumas they suffered, they're still dealing with. Whatever trauma, there are additional traumas that they have from having Lyme, but whatever was going on before didn't go away. There are external sources of emotional issues also. The stress is very specific with Lyme disease. There's learning to be patient and maintaining a good relationship with your doctor, the changing identity, but it's a very lonely illness. There's a huge amount of crowdsourced information. There's a lot of gaslighting of people telling you you're crazy and you're not really sick. And then there's a PTSD from all of the interactions they've had with the medical establishment that have not been helpful. And some of them have had psychiatric hospitalizations, tremendously traumatizing. So before I begin anything that I would even think of as treatment, I try to address some of the issues of self. And I try to help give the patient a sense of meaning to what they're suffering from, to make it understandable, to take away the self-blame, the guilt, and the shame. I try to help them reconnect with whatever source of spirituality has given them comfort in the past. And I try to make accepting help to be something acceptable. I have a phrase that I use with my patients, which is, if you can't be the light, be the vessel, and give somebody else the gift of being the light to you. And when you're well, you will be the light to somebody else. And that seems to allow people to accept help who are not willing to beforehand. So these are like before even beginning what I would consider treatment. I learn about their support system, the strengths and weaknesses of the support system they have, and I try to undo the aloneness by forming a strong personal bond with them. And then in terms of an approach overall, the very first thing I do is try to work on improving sleep. And anybody that wants to can just photograph, or take a screenshot of the slides I've put up here. I'm not going to address all of these things, but I begin by using supplements and herbals to try to help people sleep. Medications are my second choice. And after sleep, which is the biggest change you can make in somebody's life, then I'll go on to trying to improve the brain fog. And again, I start off with lifestyle changes, dietary changes, and supplements. And these are some of them. And then I can move on to step 3, which is to decrease the inflammation. All of the symptoms that we're talking about that are neuropsychiatric symptoms are a result of cerebral inflammation. And there are many things that you can do that are not drugs. So meditation is a good one. And there are a lot of apps that my patients like. EFT, which is a tapping technique, is extremely powerful, and people can find guides on the internet. I encourage people to exercise in whatever way they can without pushing themselves too much. The anti-inflammatory diet, getting outdoors, it really means a whole lot to just get somebody outside. And I try to teach people to just play the hand that they're dealt with today and not try to push through things, but that you can decrease inflammation by letting yourself rest. People talk a lot about detox, and there are ways in which we can improve detoxification with vitamins, with supplements. We can decrease the activation of the microglia, which are the cause of symptoms, the cytokine release. We can give neuroprotectants. So there are many, many interventions that we can make that are not actually treating psychiatric symptoms, but are aimed at lowering the inflammation. These are the things that I would do before giving somebody a pill that was a major drug. I want to try to do this, and I want to try to get inflammation decreased before they're into a heavy Lyme treatment, which is going to cause more inflammation and Herxheimer's. But when people are treated, they do have Herxheimer reactions, which make their psychiatric symptoms worse. And so this is a basic Herxheimer protocol. And it's a poking and a prodding of trying different things to see if they will help. You can alkalinize with Alka-Seltzer Golden Lemon. You can test to see whether some of this is mast cell by trying Benadryl. You can decrease the excitatory effects that the inflammation is causing with magnesium and Epsom salt baths. Some people have high ammonia, and that will respond to ornithine and citrulline. Curcumin is anti-inflammatory. Boswellia is a great brain anti-inflammatory, and glutathione. And there are other things to do, but this is a basic outline for which we can begin to deal with these things that everybody's going to have. So that's sort of my overall way of looking at this and going about treatment. And I thought it might just be helpful for people to see that there's something systematic in how we have an approach to this. And I'm going to stop the share here. And that's my approach. I can't hear you.
Oh, you're muted, Noah.
Okay.
Thank you very much for sharing, Dr. Mark. I wanted to open the floor to either Audrey or Rosalie for any responses they may have to that, or anything that I see. There's a lot of stuff going on in the chat, but it's the fact that I'm on my phone, I can't read both at the same time. Is there anything in the chat that might be worth noting based off of Dr. Marks's?
So, yeah, there are questions.
Okay.
We have some questions about how the physicians feel about the use of herbs. Non-specific to any specific part of the body, just how do you guys feel about herb use?
Depends on what the problem is, depends on what the herb is. I guess what struck me with what Jane said, Dr. Marks, is that I have a very different practice. Now, I only see children and adolescents. I kind of function as a tertiary referral center. I get the kids that are really hard to treat, that other people can't diagnose or can't stabilize. And so I'm the one who has been making the diagnosis of the tick-borne illness. In most of the kids I see, they don't come to me for tick-borne illness. I looked at my results. I had 69 kids, and only 6 of them came to me because they had Lyme and they were having problems with the Herxheimer's. I was the one who diagnosed tick-borne illness. And the way I did that was, as I said, the step before Jane. I was working as a medical detective, I guess. You know, in medical school, we learn 90% of diagnosis is history. So I get an incredibly detailed history, and I'll have parents get the records from every pediatrician the kid's ever seen. And then I'll look at the child's symptoms, but I'll also go through family history. Not uncommon to discover that actually mom in her 20s had something. They thought it might be MS or maybe it was lupus, but they could never prove what it was. And they were just never sure. And then she seemed to do better and she has these aches and pains. And then I wind up coming to them after testing of the kids and then referring the mom because I think the kid's got congenital Lyme. I have picked up at least a handful of cases of that, even though that's supposedly rare, which is hard for me to believe, given I have a small practice and I can tell you 5 kids where I've diagnosed it. So I'm looking at the family history, kids presenting symptoms, the cognitive difficulties, but you have to remember, kids are a work in progress. So we all have geniuses, you know, at age 5, And then maybe at age 8, they're not so smart. And of course, as parents, we blame ourselves. But the reality is there can be cognitive decrements that are really affecting what you're seeing and affecting that growth trajectory. And having tick-borne illness early on, all things the doctor said, you can't even develop in your identity. If you're a kid that has bad separation anxiety due to your tick-borne illness and don't go to school, you're not growing socially, emotionally, educationally. Your growth is stunted and you're not going to be all that you could be. Also, since everybody told you were so smart and now you discover you can't remember anything, you have a very low self-esteem. And loneliness, the parents especially, and going to what Audrey, I'm sure we'll talk more about, is when you treat a child and work with a child doesn't live in isolation. And so and they're not the ones who decided, let me come and see you. I want to see the doctor. So you work with a treatment system. And I feel that the parents, we're all a team together. You know, I may give them the work, they got to go home and follow up. You know, he's nice with me for 45 minutes, but they've got to put up with the rages. And how do they deal with it? And we work together and educate each other. And one thing that my patients tell me that they found so powerful, which I never realized this till they told me, is once I have a kid that's along in treatment and doing better, I kind of hook that parent up with somebody who's newer in my practice, who has a kid who looks like Damien from Hell, who I know is really a sweetheart and is going to be fine. But that's giving the parent hope. Been there, done that. It really can happen because you're so alone and you figure, no, you can't, your relatives tell you it's your fault. Nobody's going to believe you about tick-borne illness, especially. And it's great to have people support you who know what it's like. And also how embarrassing that the whole family, all their life revolves around one sick child. Okay, there's collateral damage to the siblings. Parents, often the mother has to stop working because these kids are really sick and require a lot of doctors and a lot of attention. So it's a whole, it just changes life dramatically. But I think it's always important, like Jane said, you've got to help them know that there really is hope. And in psychiatry, as in other areas of medicine, we talk about treatment resistance. To me, treatment resistant type of symptoms means, well, you're treating the wrong thing. That's why it's resistant. And you need to get a better diagnosis and a better understanding of what you've got. And I guess, let me stop there.
No, Dr. Greenberg, I think you really laid the groundwork here for that segue to discussing with Audrey, that, as you stated, it's impossible to keep your patient in the sterile environment of your practice. You know, there's always going to be things that are occurring outside, out of your control as a practitioner, and things that may cause triggers or other issues for the individual. So the question I would pose to Audrey first are, what type of systemic issues face Lyme patients and they trigger patients and their the interactions that you may have with them?
Yeah, well, I mean, I think Dr. Greenberg started speaking to the heart of the matter, in that you have a situation in which nobody knows intrinsically how to handle that. We don't come in equipped with, what do you do when you have a child or you yourself are in this state? It's something we have to learn and adapt to. So I sort of think of the systemic approach as being like concentric circles that start with the individual at the center, and then you have the family system, you have the sort of more medium level systems like the schools, your community right around you, your religious community, whatever's in your more immediate outer circle. And then you're going right on up to larger things like the medical establishment, the school systems, things that may or may not actually be equipped to handle what's going on or may not know about what's going on. So you can work with the individual all you want, but really creating an extensive network of support, which I think starts with education, just beginning to help at the individual level. What is going on for you? How do you help the person understand what is happening in your body, what is happening in your child's body? Especially for children, it's really unsettling when something is happening and you don't understand what is going on with you. And that so directly correlates with this sort of grief and loss, the loss of identity. People blame themselves. There's a lot of shame and guilt. Why can't I do this? Why did I act like that? So first, just beginning to build a framework of sort of knowing what's happening to my body. And I think it's really important to keep coming back to the fact that there is a biological infectious process here. It is not about willpower. It is not about being better. And really rooting in that awareness, and then helping build those concentric circles of systems that can reify that awareness when the individual is having a hard time. The caregiver, the partner, if you're lucky, the boss at work, right? People who can help support you in, like, we understand that there's illness here as opposed to some sort of moral failing or lack of effort. Certainly, I think some of the biggest institutional the word perpetrators came to mind. I don't think that's really accurate, but I think it can feel that way. School systems, the medical establishment. I mean, pretty much anyone with Lyme disease that you talk to has a story, at least, sometimes dozens of stories about seeking medical help, whether it's psychological or otherwise, and having someone really invalidate their experience, accuse them of malingering, put them in a diagnosis bucket that is not accurate. And all of that takes a toll. And we were sort of talking about this earlier, but there is this parsing that has to be done of what is a neuropsychiatric manifestation of an infectious disease process, and what is the natural emotional fallout of going through this kind of extended trauma without support and systems that are really there for you, and being able to sort of approach it from both ends.
That is very insightful, Audrey, and I think it leads very well into my follow-up question, which is, as you mentioned, there's concentric circles that you can build out to create a network that allows a patient to not feel that loneliness that not only yourself, but also Dr. Greenberg mentioned. So in order for that individual and potentially caregivers who may be on a call wondering, how do you build that out, especially with so many stigmas associated with mental health, how would you suggest individuals and their caregivers who are assisting them through this process break down those stigmas and really address those barriers or quote unquote perpetrators of the systemic hold from being able to find a way towards recovery?
Are you asking me directly, or are you opening that up?
Yes, that's a follow-up question back to you, Audrey.
Sure. Yeah. So the way I like to talk about it with my patients is starting with sort of building like your bubble. And, first it's your husband, your wife, your romantic partner of any kind, your kids, beginning to really educate yourselves and get solid on understanding what is happening, and then developing practices for how to manage what is happening. So you have this steady core, because the more you move to the outer circles, the more you're going to need that fortitude and that home base of being able to trust each other, count on each other. So I think it tends to start in the inner circle. And then from the inner circle, beginning to bring education and sharing experience. I think as much as possible, sharing with those around you what's going on, providing literature or referring them to resources can help. Some of it has to do with just ignorance all through the systems, people not understanding what's really going on. If I say to you, I'm going through chemotherapy, there's sort of a cultural reference for that, right? You kind of know what I'm up against. If I say, oh, I'm on week 6 and I'm in a big herx and I'm on this intravenous antibiotic, people don't really understand what that means, right? So then when you're late to work or you're snappy with your spouse, and there's not that like real understanding. And so the more you can speak about that and understand it yourself, I think the better. And I encourage people, like, start with keeping your circle tight, even if that means you just start with your therapist, your psychiatrist, and begin to build up some of that fortitude that, like, you really are, you're working on something, and that's solid in you, and some pride and some connection there, talking to other people going through it, all of that. And then little by little beginning to spread it out.
I think that's really impactful. And I want to open the same question over to Dr. Greenberg and Dr. Mark to provide a little bit of follow-up as to how you may provide those coping strategies and skills to your patients as well, in building their networks and building their own personal education as to what they are going through.
Kids are different, okay? They're a work in progress, and they take in a lot of what is going on with them. And of course, if the teacher's disappointed, the parents feel like they can't deal with this kid, and everybody's yelling at them all the time. As I said, you don't feel too good about yourself. For the kids, I try and explain it to them. Look, you get angry very easily, but part of it has to do with these bugs. These bugs, sometimes when you treat them, they make kids have their knees get very hot and very painful as you give them medicine. Well, for you, it kind of makes your brain hotter. And so you may be more angry and you may be more irritable. Now, that's really hard, okay? Because it's not your fault. But it is your responsibility to learn how to deal with those feelings. You don't have to like it. But as you grow older, when you're a big person and you have a bad day and you're getting treated for something and your anger flares, you can't tell your boss, I can't stand it anymore, yell at him and say, I'm sorry, I had a herx yesterday. You're not going to keep your job. So I try to put it in ways that the kids can understand. But also for kids, you're working with multiple systems, and that's where education is key. Often I have to educate the pediatrician who has learned that Lyme, you give them an antibiotic for a week and it's gone, and somehow it doesn't work that way. The school system, he's not being a bad kid by not going. He's scared to death. Most of my kids actually would love to be able to go. But think of it. If you can't focus, and let's say you have a kid that's already had some attention deficit, and then your processing speed is off, where everything comes in slower and goes out slower, do you know what a challenge that classroom has to be? Another way to make you feel like a moron. And so we have to teach the teachers, and we also have to teach, we're team, like I said, with the parents. I mean, I teach them and they bring articles in for me. And I think that's grand. And I try and teach the child about his disorder, depending upon his age. But you can't go break things. When you're older, you'll be in jail. Well, you keep this up, you're going to be in the hospital. I don't think it's going to be fun. So I know it's very hard, but you have to learn how to control that. And parenting then becomes a different thing, because you feel like your child is Damien, the devil child, sometimes. And the truth is, when you're feeling angry and upset, you're just mirroring what the kid has inside of him, but it's much more. And it's much more intense. And can you imagine being a child and suffering that way? So sometimes parents need a timeout. That's a very important thing. Okay, we're not saints. And there are moments you need to walk away because the kid has gotten to you too much. So there are a bunch of different techniques and approaches all over the environment to help these kids. So it's not just working with one person or whatever. You're working with various systems. even the Boy Scouts, can he go this week or not? So it's complex, but it's wonderful.
I really appreciate you addressing not only the patient experience, but the caregiver experience, because I know as working with Project Lyme, that's essentially our two audiences. We have individuals who are going through it themselves and individuals who are concerned for their loved one who is going through Lyme disease. So it's really good to address both sides of the coin and show that, not only does it affect the individual, but it affects the entirety of those circles that Audrey had mentioned earlier. But now I want to swing over to Dr. Mark and exactly what Dr. Greenberg was just explaining. I liked her physical movements with it as well, of a flare-up. Could you, Dr. Mark, please define what a flare-up is or may look like for our audience, as well as how you would suggest a patient would cope not only with the actual event of a psychiatric flare-up, but that fallout that we had discussed earlier with things like shame and other types of feelings that are associated with that.
Dr. Mark, you're muted. Oh,
Yeah, got it. Two different kinds of flare-ups. One of them is that you're getting sicker, that you're not being treated yet. Treatment's not working yet. And every few weeks you get worse because every few weeks the bugs are multiplying. And that is a real sickening. And in our patients who have late Lyme, which is living in the nervous system, that will frequently take the form of psychiatric symptoms. There's another kind of flare, which is a Herxheimer. And that's when patients are being treated and it's a successful treatment, but the die-off causes a release of toxins and inflammation in the same place where the organisms were living, causing symptoms to begin with. So all of their normal symptoms get a lot worse, but it's actually part of getting better. So people have to deal with both of them. The main thing that I try to teach people is to play the hand that you're dealt today, to not try to fight symptoms, to not try to make them go away, to not try to understand every single symptom, what caused it, what did I eat, what didn't I eat, but to just do what your body is telling you is the right thing for today. And if it's rest, it's rest. And if it's go for a walk, and just go for a walk and be away from people, that's fine. If it's talk to one person you know and get comfort, if it's get comfort from music, it's just do whatever you can to get through without fighting. And that's a hard thing to teach, but I find that it's one of the most important things that I do teach, because the effort put in fighting being sick takes a huge amount of energy, and there is no spare energy. So sort of surrender to what your body is doing, go along with it, recognize that it's either a herx or it's a flare. And at the same time, as I get to know my patients better, I try to come up with a list of sort of what's in their go bag. What are the things that that you can have written down, so when you're not in a state of mind that you can remember, you can read it, you can look at it. Oh yeah, if I meditate, if I do an app from Calm, if I do tapping, I can call this friend. I can do that, but have a list and know exactly what it is that's been helpful in the past to help you get through. Because these all end, they're self-limited. A herx will die down, a flare will die down. And we're in a marathon, we're not in a sprint. So preserve your energy. When the flare or the herx has really very detrimental psychiatric symptoms and there's a rage attack, or a real episode of psychosis, then there's even more to deal with it, because we have to deal with the shame of how that felt. And was there a way of protecting people against it? Or was there a way of protecting yourself? Would it have been more protective to have actually not told your doctor? Sometimes that might be the thing. So we try to develop a toolkit for what are the things that help get you through. Another thing is I try to get permission to talk to as much family as I can. And not everybody wants to give permission, but when patients give permission, then I can involve family and I can educate. Education is an ongoing issue here, and it just doesn't stop. And educating the family about what a patient is going through at any particular point in time is really key. So,
yeah,
have I answered?
Oh, you answered it perfectly, Dr. Mark. Thank you so much. And I want to take this time right now to plug Project Lyme a little bit here. Something that I would have loved to share immediately after you explain some of those things, like a go bag and these very actionable steps for individuals, which sadly I can't because I'm on my phone. But what I would encourage individuals to do is check out our website, projectlyme.org. We just launched a new website on Tuesday. There's currently some mental health resources on the website itself if you want more of a written guide rather that essentially reiterates a lot of the things that Dr. Mark was just talking about. So if you're looking for additional resources or would like to send it to somebody in your network who may need to learn some of these things that you have heard from this evening's presentation, definitely check out projectlyme.org under the Exploring Treatment section of the Your Lyme Journey. I would have loved to show everybody how to get there and what to do with it, because it is a very new website. But again, just head on over there and check things out. At this time, the fact that we are about an hour in and there's a lot of questions coming in from the audience, I want to pivot now to giving the platform over to individuals who have been asking questions. But first, I wanted to touch on some requests that I had received prior to the event from my email, and people are interested in asking some things to our panelists here. First is less of a question for the panelists, but again, more of a self-plug here as to some resources that we have on the Project Lyme website. There's an individual named Patricia who has a daughter who has been dealing with Lyme and Bartonella and a lot of psychiatric issues attributed to that. And luckily, she has been working with a Lyme specialist who has been prescribing her supplements and other types of integrative therapy that have allowed her to feel the healthiest she has been in years. However, these supplements are extremely expensive and not covered by insurance, as I'm sure many individuals may know. So what I want to point to on the Project Lyme website that Patricia and any other individuals who feel that they are struggling financially to manage the treatment aspects of it, we have a resource on the website that is compiling financial assistance programs from around the country that you'll be able to look a little bit more into their grant processes. And a resource that we're hoping to get out within the next couple of weeks will actually be a more in-depth dive as to how to apply to those resources and take those proper steps to finding a way to make sure you're able to continue with your treatments and allow you to stay healthy and stay well and stay on your road to recovery. So that was just a quick plug I wanted to put in there. And now I'll jump into some questions from individuals. First is treating psych factors associated with Lyme requires a unique understanding of the pathogen that many psychiatrists and psychologists do not currently possess. So is there a database of recommended psychiatrists or psychologists for Lyme patients to use? And would it prevent the patient themselves from having to do a lot of this groundwork? Obviously, I will give each individual a chance to respond here because I personally do not know of a database, but there either may be some information or insight that you have into the industry that I myself may not. So I'll go ahead and start with first Dr. Mark, and then we'll go Dr. Greenberg and Audrey with their responses to that question.
Well, I would say that there aren't that many of us who really specialize in tick-borne disease and psychiatry at this point in time. But seeing as it's a trending illness, younger psychiatrists are getting exposed to it, and there will be more and more. And the best resource is ilads.org, has a list of doctors all over the country and what their specialties are, who can help with every aspect. So I would use that website. And I mean, I would also use anybody that you know or is treating your Lyme to ask about who they would recommend and who they've worked with, because frequently we work as a team. And, you know, there are a whole bunch of Lyme doctors who I have experience with, and they have experience with me. And I'm sure it's that way for everybody who's in the war.
I'll go ahead and shift that same question over to Dr. Greenberg. Thank you, Dr. Mark. You're correct. ILADS is a great resource. Dr. Greenberg, do you have any additional insight?
Not really. Only, you know, again, it's that same thing. Asking your treating doctor, or you'll wind up discovering it's like buying a car. Once you want to buy a certain kind, you see it all over the place. Well, once you know about Lyme, you start talking about it. Everybody under the sun has had it. But through that network, it's often where you're going to get your referrals. I wish there was something formal. But it's too early. It is too, unfortunately. But there are very few child psychiatrists that really understand this and are open to even thinking about it, which is a shame. But as I agree with Jane, I think that is changing. It's absolutely changing. But it's a problem.
I will go ahead and shift it now over to Audrey for the therapist perspective. Do you know many other individuals in your profession who have a good grasp on Lyme disease the way that you yourself may?
I echo the same sentiment we've been hearing. It's just kind of a small niche at this point. There's just not a lot of education. There's not a lot of people who have worked with it. ILADS is a great resource. I agree. That's the one I usually use. And word of mouth, talking to people, seeing who they know. I will say, I think those of us who work in the field are really committed to what we do, and reach out. Even if you know that someone is full or they treat kids and you're an adult, ask someone if they know someone, because sometimes that's the best resource at your disposal. And at the very least, there may be what I'm going to call Lyme-friendly practitioners. If you really can't get access to someone who is really literate and specializes, you may be able to find some people who know enough about it or are open to it, such that they can work with your Lyme literate physician, or they're willing to sort of hear your story in a different way and educate themselves. So don't lose hope, because I do think that there are people who, even if they aren't your first choice, may be willing to join you in your efforts to find some relief.
Yeah, you make a great point, Audrey, specifically talking about working not only with your specialist, but also with a therapist or any other individuals that you're working with. And the main reason that that's important is that with Lyme, obviously, there's not only the psychiatric symptoms that we're talking about, but there's other symptoms that impact you on a more physical level that may require you to have a team of doctors rather than just one individual, which is sadly why so many people are going through financial issues related to things brought on from Lyme. I did see.
Oh, go ahead.
Go ahead.
I just want to sort of empower people to feel like they can be in control of choosing if a provider is not a fit. There is enough trauma and enough mistreatment from providers that if you go to a psychiatrist or a therapist and you don't feel like they're really listening to you, or you don't feel like you're being respected around what you went through, you should keep looking. You do not have to endure that.
That's a really powerful statement. And I think that agency for patients is something that is growing, but especially within the Lyme world, definitely not something that I think patients have as much agency as you had mentioned earlier with something like a cancer, just because of how well known it might be. So I actually am going to come right back to you, Audrey, with another question that I had received prior to the event beginning, which is for those patients who don't want to dump all their daily anxiety and pain and struggles on family members who, as we had discussed earlier, also equally affected by the disease. Is there a good mental exercise that you would suggest that they can do in tougher moments, so there's not necessarily as much of a need to verbalize? Or would you suggest against trying to hold things in?
Well, I actually think Dr. Mark made a really good point about sort of not resisting what is, right? So if you're in a place where you are just welled up with emotion on that day, maybe it's a herx, maybe it's a flare, but maybe it's just you've had 5 days in a row where you felt bad and no one's been there to support you and you've just had it, right? Because you're human. I think it takes a lot of energy that often one doesn't have to try and contain or deny that. And it ends up looking like trying to invalidate yourself, which, enough is happening to you. You don't need to bully yourself around that. So I actually encourage people to find creative ways to honor that and voice that, even if it's not to the people around them. The most traditional model of this is journaling. Some people don't like journaling. Some people are having cognitive stuff going on where that's not a good choice for them. I have had patients in the past keep like a voice log on their phone where they will just go into a private place and just like speak all that's in there, and it just feels good and they sort of have it. And maybe they keep it for themselves because there's something powerful in that, or maybe then they just delete it because then it can go into the ether of technology and that's the end. But certainly there are all kinds of creative ways to allow it. But I would say find ways to build a safe container around it rather than to disallow it completely.
Yeah, go ahead. Go ahead.
I agree with absolutely everything that Audrey said, but I want to add something that sounds a little contrary, which is that there's a time for distraction from your pain. So there's a time when you're feeling a lot of pain, and if you go there and you just stay there, it becomes more and more, and it becomes too overwhelming because you're not in a cognitive place to be able to think your way out of it. And that's the time to put a comedy on Netflix. And, it's okay to not delve into it and stay there with it. It can be too much at times.
And I guess, I'm sorry.
Go ahead. Go ahead.
I'm just thinking, with that whole idea with a child, that issue about control, how much do you let it out, and having some limits. Well, neurologically, they're immature. And that's also where it's a team effort. The parent is the one who's looking out for safety. That is their primary thing. Because the kids are not going to journal if they're young enough. They're just going to yell and scream at you and be impossible. And so as a parent, you need to protect them and protect yourself. And that's a very important thing, because during these times of explosive feelings and behavior, it can be very dangerous. So if you know that you have a kid who's going to go into yelling fits and throwing fits, don't leave knives out in the kitchen. Put your knives away. Lock up your medicine if you're worried your kid is suicidal. Basically, during these intense emotional storms, your job is to protect them from themselves and protect everybody in the environment. And that's extremely important because the kids don't have enough of those controls. They may know what to do, but they can't do what they know at those moments. And one has to realize that as a parent. So that's just another aspect of it, that you've got parents providing that safety net and that area of diffusion, but keeping it safe. They're the safety around the child. That's their job.
Thank you so much for all three of you for sharing your insights there. I wanted to jump real quick to a message that I saw pop up that is extremely true in terms of medical route or a non-professional route to being able to have community around you, which is something that Project Lyme offers through our initiative Generation Lyme. It is a support group for specifically built originally to empower young people. However, it is very accepting of any individual who is looking to share their story. I would suggest that you either check them out on Instagram or at genlyme.org. They provide 4 at the very least, sometimes additional to that, meetups per week, which are hosted by Lyme patients, attended entirely by Lyme patients, focused on the ability to share your story and build that community that may be so hard to build, especially in times like COVID-19 and in an already immunocompromised group of individuals. So I now want to take a step further just based on some of the things that Dr. Greenberg was sharing. And I'll start first with you, Dr. Greenberg, then move to Dr. Mark, and then move to Audrey, which is, what is an example of one of the most difficult cases that you've encountered with an individual going through their own neuropsychiatric symptoms?
Well, I had one young man. He was around 11. He had been hospitalized, 2 psychiatric hospitalizations because he was suicidal, homicidal, he heard voices. He would talk to his hand and sometimes act as if it was a telephone. I mean, clear breaks with reality. And they put him on every psychiatric medication I've ever heard of in my life. And it didn't do much. And they had all these consultants, and they were across the country, and they got my name somewhere, and they said, well, can you see him? And I said, look, I don't know if I can help, but sure, I'll try. And it wound up he had Lyme, Babesia, and Bartonella. Okay. But then he had to go back home. And then the problem was, well, how do you get somebody to treat him? The infectious disease doctors really didn't believe it. The child wound up hospitalized again. They gave him, though, a low dose of treatment for a short period of time, and for a bunch of reasons, they were able to totally dismiss it, that it had any effect. Then to get him as an outpatient, well, a child like this, when he herxes, you're going to have a kid who really could be quite dangerous. And so a lot of doctors were afraid to treat him. Now, eventually, I did get him treated, but it delayed the kid even starting getting the right treatment until almost a year after I first saw him. And it's been a very long road, and he's still struggling. It's a few years later. And part of it is the medical establishment having so much controversy and not accepting that we've got these kids that are really being traumatized by not getting proper diagnosis and proper treatment. And also the insurance companies that love to save money and say, chronic Lyme, it doesn't exist. I don't know what's the matter there. It's not my responsibility. It destroys families. It is a horrible situation. And this child, things have looked better, but we're not where we need to be. And in part, I really blame that on our medical system.
No, you're exactly correct. Before you mentioned it, having heard you walk through his situation, that's the first thing that stuck out to me, is that obviously there's still a need, and that's why organizations like Project Lyme exist, to continue to educate not only individuals in the community, but outside of the community as to what patients with Lyme disease are truly facing, and to ensure that individuals do not go undiagnosed as long as they have in the past. So I'll go ahead and swing it over to Dr. Mark with essentially the exact same question. What has been a very difficult situation for you with a patient, and did you see a positive resolution, whereas Dr. Greenberg is still on that path?
So the worst psychiatric symptoms that I've ever seen, I think, were just 2 years ago, not long before the COVID lockdown. It was an 18-year-old girl who had developed anxiety at age 11. And up until age 11, she was friendly and outgoing. She liked theater. She liked being in plays. She played sports. She had friends, good student, everything that you would want to see your daughter grow up to be at 11. And then she suddenly became anxious, and she became afraid to go to school, afraid to socialize. It wasn't clear like how this happened. It was just so sudden, and it was a change of personality. Her mom had a miscarriage, and she developed the fear that it was because she had laughed or smiled at the bad news that this could happen again, and she decided to never smile again. So she refused to do anything that might make her smile, including watching TV. In 2000, she was treated for anxiety by psychotherapists and psychiatrists, and nothing particularly helped. In 2015, she had a brain MRI and an EEG, which both showed subtle abnormalities. No diagnosis was made. But in 2016, there was a big change. She had the Gardasil vaccine. And immediately afterwards, she began vocalizing and having tics, wild tics. She punched herself hard in the head. She yelled, she jumped. She compulsively would lift up her blouse. She picked up knives. She attacked her mother. She whispered to herself almost constantly, afraid of bad things happening to her because she was evil, and she would have conversations to prevent evil. So she became completely homebound and homeschooled. She was seen by an LLMD, by our Dr. Jones, who identified that she had Bartonella and Babesia. She had a year of treatment with IVIG that did not help, but then she had a treatment with azithromycin, Bactrim, and Mepron, and Luvox for her OCD tic symptoms. And I'll tell you, when I saw this young girl, I did not know what I was going to be able to do for her. She could not have a conversation with me in my office. Everything prompted her to talk to herself. She was moving around. I ended up picking up a ball, and I threw the ball at her. And I think this came to me out of seeing a movie about Parkinson's patients. She caught the ball. And when she caught the ball, she was like not doing the tick thing. And she saw me, and she threw the ball back. And so I played catch with her in order to have a conversation, because as long as I could keep her throwing the ball, I could keep her away from what her tics and OCD were forcing her to do. And this was clearly, this girl had pre-existing Lyme that had been undiagnosed, and that was the anxiety that had come on at 11 or 12. And the HPV vaccine was a trigger for it to become just a very flagrant, severe case with very bad neuroinflammation. I didn't know if she was ever going to get better, and I was afraid that this girl was going to be a suicide. It was very frightening to see. It was terribly disturbing. She was a beautiful young girl. She couldn't keep coming to see me because her dad needed to take the train, and she couldn't go on the train because she would keep undressing. So she went into the care of another doctor, and he kept her on the Luvox. And in a year of azithromycin, Bactrim, Mepron, Luvox, and hemp oil, which has been very important to her, and low-dose naltrexone, she's going to college next year. And she's not achieving what she might. She might have been, headed to be a lawyer, but she's starting off at junior college, and she's headed for a medical lab tech degree. And depending on how she does and does in working in a hospital, who knows what she'll end up doing. She still has some intrusive thoughts, but She knows that they're intrusive thoughts and she doesn't find that she needs to engage with them. She can ignore them. So I think she's a real success and sick from age 11 till age 20.
Yeah, thank you so much for sharing that story. And I just want to say now to everybody who's on here that I hope that you are not like this woman and that you all find the ability to smile. And I'm hoping that she has found her way back to that as well. We're cutting it really close on time here. I really appreciate everybody for sticking with us this long. Audrey, I would not pose this question to you. I'd rather ask again to check the chat, see if there's anything really extremely important that we need to touch on before we end it for the evening. Can you please do that?
Sure. Yeah. So for time management here, rather than a specific question, there's a theme that I'm seeing coming up, and I would love to just really quickly have each of us speak to this. There's a sort of theme of, does it ever actually go away? Can it really get better? Maybe each of us can like speak quickly to the sort of hope component. What is the prognosis? How much should people be feeling that there is some room for optimism? Dr. Greenberg, do you want to start? I see you.
There absolutely is room. Well, okay, that's me. I'm very dramatic.
I love it.
But there absolutely is room for optimism. That's just it. And that's what I always tell the parents, especially because my kids can be incredibly difficult and not the best behavior. And yet also they are kids who often can be the sweetest, most wonderful, or at least the parents have a vague memory. They were that way a few years ago before they got sick. And I try to remind them that that is in there. It's just, how do we get back to it? I don't possess anything to make anybody nice. I don't have that medicine. But that's still in there. And I've seen kids, get past this cognitive issues. I've seen them get past the psychosis. I've seen them get past their bipolar type symptoms. But I tell them it's a road and it's gonna go up and it's gonna go down, but that doesn't mean it can't have a great ending. And I think that's really important because I believe that. I absolutely believe that. If we don't know the answer now, okay, then maybe in another year or two, or maybe somebody else, but you don't give up. It's not an option.
I think that, people always want to know, does anybody ever get better from this, or do these organisms stay forever, or can I get better? And the answer to that is both can be true, and you can simultaneously get better. We have better and better drugs to address the persisting forms of these organisms, and that's very important. We started out killing the most active forms of the organisms, the ones that were out there, were dividing, were doing damage, without understanding that there were some that would go into hiding and would then come out again when your immune system was in a bad place. So we're better at killing the last organism. And that's a wonderful thing to know. There are more and more drugs that do that. And even if we don't kill the last organism, that we're also at a point where we have a lot of tools for keeping you relatively well, and then recognizing when a retreatment may be necessary. So, I said I got well, and it took 1.5 years of antibiotics. For 2 years, I traveled. I went to Morocco, I went to Egypt, I went to Burma. I did all kinds of things that I hadn't done for decades. And then I relapsed. Well, I got treated for the relapse. I think I'm doing pretty damn well right now. I had COVID and I've developed symptoms, and we don't know if those are long haul symptoms or if somehow COVID reactivated whatever Lyme might have been there. So that's something to tease out. But I have a doctor that I work with and tease it out. And, you know, if there are some last Lyme organisms that we didn't kill when we treated persisters last time and they're coming out, well, we'll give them another round. They'll go back down and, you know, I'll get another X number of years out of that. And, you know, it may be that it becomes a chronic disease, but it becomes a chronic disease that we learn how to control. And it may be with intermittent antibiotics. There are some people who live on doxycycline for life, you know, and there are some people who do very well on herbals for life. I know that, you know, I was taking some herbals when I was originally cured. And after taking them for a year and a half and not getting sick, I thought, oh, I'll stop these. But maybe they were really helping my immune system stay well. So, you know, we don't usually kill the last bacteria. Even when you get a strep throat and you're young, we end up with strep and we live with it. So that may be what ends up happening to many people. Some completely cured and some having to deal with residual.
Yeah, I'll echo that sentiment. I know we're just like right up to time here, so I'll be very brief. You know, I think if I had to distill it down to just a soundbite or two, I think it's important to know that your worst day is not going to be your everyday, and you will have more and more and more good days over time. And there may be other bad days, but there is so much room for lots more good days coming. And that is something I think all three of us have seen time and time again with proper treatment and proper support, that like they will come and they will become more. Yeah.
I want to amplify what you just said. Your bad days aren't going to be how you feel all the time, but every time you have a good day, know that that means that your body still has neuroplasticity and an ability to grow. And that good day is your potential to have more and more often.
Absolutely. Yeah. And then the last little soundbite would just be that I think Lyme can change things. Lyme can diminish things. It can even take things away. But I think the thing that I keep seeing over and over, and I don't know how the two of you feel, but that the core thing that is you, that can't get taken away, and that does come back. Yeah.
Thank you so much, Audrey. Thank you so much, Dr. Greenberg. Thank you so much, Dr. Mark. That is our time for this evening. I really appreciate all of the insights that you provided, not only to myself here, but the entirety of our community that has been able to attend. Thank you to our community for sticking through technical issues at the end. In the beginning there, this ended up working out very well, in my opinion. For those asking questions, I know that a continual question that always comes up is, will this be available afterwards? And yes, I'm going to work with Audrey to get her, to get myself the recording from her. It will be uploaded to our website and to our YouTube page. We'll be sharing the link to the YouTube video and to the website via social media sometime within the coming week, depending on some variables here. Obviously, it's not on my computer the way that it usually would be. So thank you again to everybody. Looking forward to our next event, which is coming up on April 8th, covering a very similar topic, but from the documentary perspective. All of those who know about The Monster Inside Me, which talks directly about neuropsychiatric symptoms and Lyme rage, we are having a live Q&A with their cast and crew 3 Thursdays from now, April 8th at 5:30 p.m. Very similar setup to this. So if you want to get your tickets to that now, they've been shared, and I'll make sure to share that link with everybody who has attended this evening. So thank you again, everyone, and have a great rest of your evening.
And Noah, you did a great job of playing the hand you were dealt.
Absolutely. You were
Yeah.
terrific.
Thank
Yeah,
you.
I appreciate you all sticking with me through that. And you know, it worked out well. I appreciate all of your insights, as I said, and I look forward to being in touch with all of you about potentially doing something like this again.
Okay.
Thank you.
Good
Have a
night.
great
Bye.
Night, everyone.